I became a nurse because when I was young, like 13, 14, my grandmother was sick and had a stroke. And she lived with us, moved in with us, and so I started with being a patient care tech. And I knew I didn't want to leave it at that. I wanted to have a good income, I wanted to support my family, I wanted to know more, do more. So I started with, in high school, becoming a patient care tech, and I went straight to nursing school.
I always knew I wanted to be in the healthcare profession. My dad's in healthcare, he's a pharmacist, and never could narrow down my field as to one specialty area that I liked, so nursing had the best opportunity to do a little bit of everything. And now that I work in the ER, I do a little bit of everything every day, so it doesn't get monotonous, and it's interesting. There's always an opportunity to learn and always neat things to see and do.
My great-grandmother always wanted to be a nurse, and I kind of was inspired from her. I also like the fact there's a lot of job opportunities out there. With this economy, you can always usually find a nursing job, and there's also a lot of different fields that you can get into. If you get bored with one job, you can always transfer to another department and learn a whole new job.
I knew I wanted to be a nurse, a bedside nurse, and I struggle with going back to school and doing something else because I can't find anything that seems to be as rewarding. Once you get away from the patient, it just doesn't seem the same.
I got the best hug yesterday of a little toddler I took care of, and it was just the sweetest thing. You know, you have that look of relief on mom's face when the kid feels better, and you know, it's rewarding to see the change in the outcome on your patients in the emergency room. That's what I enjoy about it.
I like whenever you work your 3 days in a row, you can see that person slowly improve. I used to work in ICU, and now I kind of work on the med-surg floor, and you see that person when they come in sick, and over a couple of days they will come in and be much more improved, and just making a relationship with them. It feels like you just make a difference in their life and their family member's life.
I had a patient who he would frequently, he was intubated and extubated several times. He was very ill, and he had a sore throat, couldn't speak, but he would point and gesture to things in the room, and he would point at the clock, and he would put his hands like he wanted me to pray with him and pray for more time. And I will never forget him.
I used to work in intensive care. There was one family that came in. He was just diagnosed with chronic renal failure, and they came in the ICU like every couple of weeks or once a month. He'd be in, and I'd always be assigned to him. I got really close with him and his family, and I was able to be there whenever he went through the dying process as well. So I was there at the beginning of his diagnosis, and I was with his family whenever he died.
Well, I started as a floor nurse before I went to the emergency room, and I've taken care of patients that I started with on the floor from the beginning of their diagnosis of their disease process to the emergency care that they've had in between. And there's one lady that I really got to know well because I worked nights and she had insomnia, and so we stayed up all hours of the night talking together, and now I take care of her when she comes into the emergency room and get to follow up on her progress. And it's, you know, it's really nice to become close to the families of your patients and really get to know them in this small town area and be able to see the care and the difference that you're making in their lives.